Welcome to my channel CodeMed Mastery. I'm Sanjana, a certified professional coder. I know how challenging it is to study and remember everything in your exam. So don't worry, I'm here to help you with the tips that help me clear my exam with good percentage. In today's video, let us learn CPT Integumentary chapter, important guidelines, and some important codes. Learning guidelines is very important to answer the questions correctly. So please watch the video till the end. This entire video will be on the guideline. So let's begin. Before studying the guidelines, let us learn anatomy of the integumentary system. This image is present in your ICD book as well as in your HCPCS book. Similarly, in your CPT book also, there is a diagram of the integumentary system at the beginning of the integumentary chapter. So let us look at the components of the skin. Skin involves epidermis, the outermost layer of the skin. Secondary, dermis. Third is subcutaneous tissue. Fourth is muscle. In the dermis, you can find sebaceous glands, fibroblast, collagen, elastin, and next is subcutaneous fat, where you can find superficial fascia and deep fascia. Next is the muscle, and after muscle comes the bone. You can see there is the presence of sweat gland, which produces sebum, and there is also hair follicle. You can find integumentary system anatomy explanations in your ICD book, chapter 12, diseases of the skin and subcutaneous tissue. The important things you have to remember is the skin consists of 4 layers: epidermis, dermis, subcutaneous tissue, which is also known as hypodermis, and muscle. In the integumentary system section of your CPT book, you can find all these headings and subheadings. So let us walk through these titles. So first, you will have fine needle aspiration FNA biopsy. These are the codes. Then you have skin subcutaneous and accessory structure codes, which involves introduction and removal, incision and drainage, debridement, paring or cutting, biopsy, removal of skin tags, shaving of epidermal or dermal lesions, excision, benign lesions, and excision of malignant lesions. Then in integumentary system, you have codes related to nail and pilonidal cysts. Next codes are repair codes, which involve simple repair, intermediate repair, complex repair, adjacent tissue transfer or rearrangement, skin replacement surgery, and you have grafts, skin substitute graft codes, flaps, then pressure ulcers, burns, destruction of benign or pre-malignant lesions, destruction of malignant lesions, Mohs micrographic surgery, other procedures. Then you also have codes related to breast, which is introduction, mastectomy procedure, repair and reconstruction, and also some other procedures. So today we are going to learn important guidelines related to CPC exam as well as coding operative reports. So from this section, that is your 10,000 series, you will get questions from these areas: skin, subcutaneous tissue, nails, pilonidal cysts, repair, destruction, and breast related codes. So this is an important guideline to remember. That is, we can code E&M codes with surgery codes, that is from this chapter, with modifier 57 or 25. Let us look at some important codes, that is incision and drainage. So these codes are 10040 to 10180. So you can see this is for acne surgery, 10040. Code 10060 is for incision and drainage of abscess, which is simple or single. Next, code 10061 is for complicated or multiple. In your CPT book, when you see such codes, you have to remember that this code 10061 is the intended code of 10060. It means that this code contains all the information from this code, except that this is for simple and this is for complicated or multiple. So in the questions, sometimes they'll mention simple or single, or sometimes they'll mention complicated or multiple. If they don't mention any of these terms, then how you'll understand whether it is simple or multiple? It is considered as simple if there is no packing material used. No packing material used. You can write this in your CPT book so that it will be easy while solving your exam. Next, it is known as complicated if there is use of packing material. For example, gauze. If something is mentioned like this, then it is considered as complicated or multiple. Next is code 10080, incision and drainage of piloneedle cyst. Simple. This is for complicated. So 10081 is what code? It is incision and drainage of piloneedle cyst, complicated. This is the same, incision and drainage of hematoma, seroma or fluid connection. Next, code 10160 is puncture aspiration of abscess. Then you can see incision and drainage complex post-operative wound infection, code is 10180. You can open your CPT book and highlight all these codes along with me. So the code 11000 is for debridement of extensive eczematous or infected skin up to 10% of the body surface. This is the add-on code, which is each additional 10% of the body surface. In the questions, mainly you have to read the terms like debridement of skin if they are asking subcutaneous tissue, muscle, fascia or necrotizing soft tissue. If it is in the abdominal wall, with or without facial closure. All these things you have to check accurately to solve the answers correctly. Next, let us see the most important guideline. This is very important, guys. The questions are going to be asked from this section, that is 100%. So, try to understand these concepts thoroughly. So, repair or closure guidelines. Repair involves laceration repair. Okay, the repair will be of laceration only. So, laceration means it is a deep cut or tear in the skin or flesh. This is the definition of laceration, just for you to understand. So, there are three types of repair. Simple repair, intermediate repair and complex repair. In order to code repair, you have to check the length of the wound, the location of the wound and add the length of repair for same anatomic sites. For example, you can see here the simple repair of, in the question if they have mentioned, simple repair of scalp and simple repair of extremities, then you can code both of them. That is, you can add the length of repair of scalp and add the length of repair of extremity and you can select the appropriate code. This is another guideline, that is for multiple classification of repair. That is, you have to add modifier 59 or 51 to the simplest classification only. For example, if in the question complex and intermediate repair both are present, then you can code both, but you have to add modifier 59 or 51 to intermediate repair, because in complex, when you compare complex and intermediate repair, which is the simplest one? Intermediate, right? So you have to add the modifier 59 or 51 to the intermediate repair. So how will you come to know if the repair is simple repair, intermediate repair or complex repair? So let's check. In simple repair, there is wound is superficial and it requires only one layer closure. And also use of glue must be present in order to code simple repair codes. The main terms are superficial and it requires one layer closure. If in the question one layer closure is mentioned, then it is simple repair. Next, let us check intermediate repair. Intermediate repair requires layered closure of one or more of the deeper layers of subcutaneous and superficial non-muscle fascia. Also, single layer closure of heavily contaminated wounds that have required extensive cleaning or removal of particulate matter also constitutes intermediate repair. These guidelines are present in your CPT book, so please highlight all these things. The main terms you have to check in order to code intermediate repair is it requires layered closure and single layer closure of heavily contaminated wounds, and also layered suture, that is two layered suture, is also termed as intermediate repair. Next, let us check complex repair. In order to code complex repair, there must be exposure of bone, cartilage, tendon, name neurovascular structure, debridement of wound edges, extensive undermining, vermilion border. So all these things are important to code complex repair. And also 3-layered suture is termed as complex repair. In your question, if you find 3-layered suture, then it is complex repair. Next important thing is biopsy codes. That is code 11102 to 11107. So these codes include tangential, incisional or punch biopsy codes, and they include simple repair. If they include simple repair, you do not have to code simple repair codes with these biopsy codes because biopsy codes already have simple repair in them. If you code again simple repair, it will be wrong. I hope you understand. Next important thing is lesion excision. This is also very important for your CPC exam. They will surely ask 1 to 2 questions from this section. So first, let us know what is a lesion. A lesion is a region in an organ or tissue that has suffered damage. The damage may be through injury or disease such as wound, ulcer, abscess or tumor. Let us look at the lesion excision guidelines. To code lesion excision, you have to check first the type of lesion, whether the lesion is benign or malignant. So how will you find out whether it's benign or malignant? Benign lesion contains the terms neoplasm, cicatricial, fibrous, inflammatory, congenital, cystic lesions, solar keratosis. All these terms should be present in the question for you to understand that it is benign lesion. Next, how will you find out malignant lesion? The term should be present: basal cell carcinoma, squamous cell carcinoma, melanoma. Okay. Next, you have to know the location of the lesion. And third, size of the lesion. So based on these guidelines, you have to code lesion excision codes. Next important thing is, once the lesion is excised, the wounds have to be closed, right? So the wound closure is also known as repair. So the excision of lesions, that is benign or malignant lesion, they involve simple repair. So you don't have to code separately simple repair. It is already involved in excision of lesion, be it benign or malignant. Next is intermediate and complex repair needs to be coded separately with lesion excision codes. Remember that intermediate and complex repair needs to be coded separately with lesion excision, but simple repair need not be coded with lesion excision codes. Next, let us calculate the size of the lesion. The lesion size is calculated as highest diameter plus margin into 2. You have to multiply the margin 2 times. So, you can see here the diameter of this lesion is 2 cm. The diameter of this lesion is 2 cm and the margins are 0.2 cm. As per the formula, we have to add highest diameter plus margin into 2. So, margin you will multiply 2 times. So, 2.0 plus 0.4 is equal to 2.4 centimeter. So, this is the size of your lesion. Here they have mentioned excised diameter lesion plus margin. So, margin you are going to multiply 2 times, that is 0.2 plus 0.2. Another example, here the lesion diameter is 0.9 centimeter plus the margin is 0.3. So, you have to multiply it 2 times, 0.3 into 2. So, it will be 0.9 centimeter plus 0.6 is equal to 1.5 centimeter. So, this is your lesion size. You will understand all these things better when you solve questions related to guidelines in the coming videos. Okay? Next important guideline is adjacent tissue transfer, ATT. This is the abbreviation ATT. Questions from this section are also being asked, so please pay attention. So first guideline is you have to code adjacent tissue transfer if the term flap is mentioned in your question. Remember this. Second guideline, you have to code only one adjacent tissue transfer code. So the codes 14000 to 14302 are used for excision repair by adjacent tissue transfer. So as I already told you, if the term flap is mentioned or if the term Z-plasty, W-plasty, B to Y-plasty, rotation flap, random island flap, advancement flap, if all these things are mentioned, then please remember that it is ATT code. It is related to ATT codes. Also remember that the excision of a benign lesion, we already discussed this before, or excision of malignant lesion is not separately reportable with adjacent tissue transfer codes. Few other ATT guidelines, these are important. ATT includes lesion excision codes. That is, you do not have to code excision of benign or malignant lesion along with ATT. Next, ATT includes simple repair. That is, CPT allows separate coding for intermediate and complex repair. You can code intermediate and complex repair along with ATT, but you do not have to code simple repair. It is already bundled. If a traumatic wound is closed in ZYW pattern, do not code ATT. Here there is an important question for you. When excision of a malignant lesion is performed and skin defect is closed with the Z-plasty, what will you report? So the answer is report code for Z-plasty. This is based on your adjacent tissue transfer guideline. That is, Z-plasty means it is ATT only, right? So you have to code only ATT. Lesion excision is not coded with ATT because it is already bundled. Such questions will always be there in your CPC exam. Next, skin replacement surgery or graft. Let us learn some definitions and types of graft. So allograft means graft taken from different individual of same species, that is one human to another. For example, kidney transplant, lung transplant, heart transplant, etc. Next is autograft. Autograft means graft taken from same person, that is self, that is hair transplant. Next is xenograft. Xenograft is graft taken from different species. Next is isograft. Isograft is the graft taken from genetically identical twin, that is isograft. Next important topic in your CPT integumentary system is Mohs micrographic surgery. Okay, so you have to remember what is Mohs micrographic surgery. It is a technique for removal of complex or ill-defined skin cancer with histologic examination of 100% of the surgical margins. They can ask you the definition in the exam. Obviously, it is multiple choice, but you can come back and you can refer in your CPT book Mohs micrographic surgery guideline. Another important thing to remember, this also they may ask, that is, what is a tissue block in Mohs surgery? So, a tissue block in Mohs surgery is defined as an individual tissue piece embedded in a mounting medium for sectioning. In Mohs surgery, if repair is performed, you have to code it separately. You can take notes while watching this video. Next guideline. If biopsy, repair, skin graft, special staining, frozen section is performed along with Mohs micrographic surgery, you can code it separately. Next important thing to remember is to code Mohs micrographic surgery codes, you have to check anatomic site, number of tissue blocks and number of stages. So let us see how. First is we have to know the anatomic site. So to check the anatomic site, you can check the codes 17311 and 17313. So here this is for head, neck, hands, feet, genitalia or any location with surgery. This is for, you can see the location, trunk, arms, legs, etc. Okay. Next is you have to check the number of stages. So 17311 is for this anatomic locations, that is first stage. And each additional stage you have to code with this code 17312. And 17314, this is each additional stage code for 17313. That is all these anatomic locations. The additional code for next stage is 17314. So codes 17312 and 17314 is for additional stages. Now how will you report number of tissue blocks? So in this code, in this parent code, there is 5 tissue blocks. And this is also a parent code, right? Here also they have mentioned 5 tissue blocks. So how will you add other tissue blocks if it is mentioned in your question? Important code is 17315. Here you can see they have mentioned each additional block after the first 5 tissue blocks. So your first 5 tissue blocks will be in your code 17311, 5 tissue blocks, 17313, 5 tissue blocks. Along with that, you have to add 17315 for each additional block after the first 5 tissue blocks. You will understand all this clearly when you solve questions related to this section. We will solve the questions in the coming videos. You just have to understand that anatomic side you can find in code 17311, 17313. Number of tissue blocks you can find in code 17315. And number of stages is add-on codes 17312 and 17314. So guys, these were the important guidelines which you need to remember while solving your integumentary chapter questions. It is very important that you study the guidelines. There is no other way. You can write these guidelines in your CPT book. You can highlight them. Also, you can mark the important codes. All these things will be very helpful for you. Okay, so in the next video, we will solve integumentary chapter questions.